Good morning, everyone. Thank you for joining us. We will start at 5 past the hour. We're just letting in the participants, okay? Great. Good morning, everyone. Thank you for joining us for this last RTF of the year. I trust that you will find it helpful. So just in terms of logistics, I think you are now starting to get familiar with how we do this. So all participants are muted. If you remember during the actual presentations, we do have the Q&A platform. So try not to use the chat platform, use the Q&A platform so that the team, as you ask the questions, will respond to those in the background. And once we're done with all the presentations, and I think we will have time, we will then open up for questions, verbal questions that you will ask. So that's how we'll run this RTF. Douglas, I think I've covered the logistics. If we could then move to the next slide or the agenda. Mugana will share the agenda with us. So welcome again, everyone. Mugana did share the agenda with some of you, and we've received input on that. There are matters that were raised that we discussed them, and we're not going to include them here because they're very operational in their nature, and those should be tackled at the working groups, please. You know, some of the updates, for example, that you asked for, I do believe that those are updates that could be tackled at a working group. So we did look at what you've shared with us, and what we haven't catered for here, please do raise it then at your respective working groups, right? So we will then follow the agenda that's put in front of us. If I could just speak briefly to the agenda and what we will cover. So we'll go into allopathic medicines, wherein Dion, I'm not sure if, oh, he's here. Yes, welcome, Dion. He had traveled. Dion will present briefly, give us some update on the ICH survey, and Pratibha will take us through the BAU, which will speak to some of the matters that you raised around the backlog, what are we doing, the variations and all of that. So that's going to be catered there. And then we'll spend some time on the complementary medicines, which Kaiser will take us through. And then the next items, we will focus on inspectorate and regulatory compliance. Again, Dion and Daphne will speak to some of these matters. We'll have medical devices. There was a question around an update on the feasibility study. So Dimakatso will speak to that. And on the regulations also, she'll give an update on that. And then we'll also give feedback from the radiation perspective, and really an important matter around reporting of any incidents and how we do the incident management. And then we'll move to legal, where we'll talk about just some guidelines, regulations, etc. And then we'll, I think this is towards the end, we'll spend some time on the IT. I know that Christina has been having a number of workshops with yourselves. So we're not going to go here into too much detail. as I say, she'll be having workshops with you guys, and then we'll talk around. Rachad will give a brief feedback on the fees, and then after that, we will then open it up for questions, and then we will close. So again, as I say, whatever you don't find here that you raise, please tackle it at the working group, right? So again, welcome then to everyone. So briefly, in the interest of time, on the EOI for model dossiers, we did publish this, and I know we spoke about it at some point. We battled to get submissions, but we have found a workaround. I think some of you through the continental mechanism with RDNAP have indicated that you would be willing for us to use your dossier. So thank you so much. I know that there's been discussions with NEPAD and our trainers primarily from the Paul Ehrlich Institute. So thank you so much. So we are going to close this item, Mokana, from this. We have managed to get the dossiers for training through another mechanism. But thanks for being willing to consider this for us. And then the one other thing that we haven't included here, and we typically do at this point, Pratibha, just in terms of, I don't know if it'll be you who would speak to this, the SAHPRA closing times, but I think we'll probably also publish that. When are we going to close for the December period? We'll close that. So be on a lookout on our website as we communicate those dates. Okay. Thank you. I'm now going to pause here and hand over to Dion, please.
Thank you. Can you hear me?
Yes, we hear you clearly.
Okay, it's not going to be a long discussion or slide. I just want to put this in presentation mode. But basically, in the last RTF, we had provided the industry with the outcome of the survey that had been conducted. As people will know, when we're doing an ICH survey, to determine whether or not we become an ICH member. The survey is not just conducted with the regulator; it's also conducted with the industry, and they ask very important questions in terms of what is the status. Either you've adopted it fully, or you've adapted it to some point, or you've added some things on. But basically, what the survey is asking both the regulator as well as the industry, how does SAHPRA implement these three guidelines, which is ICHQ1, ICHQ7, and ICHE6, which is stability, active pharmaceutical ingredients, and good clinical practice. Now, we know as SAHPRA that we have implemented these, and it may not be obvious in certain ways. For example, ICHQ7 is word for word the PICS guidelines for APIs. So because we've implemented PICS, we've implemented ICHQ7. ICHE6, the good clinical practice guideline, is an adaptation, and it's an addition to ICHE6, for example. Now, when SAHPRA had made additional inquiries around, the details of the survey, what we had found is that there was people that were asked to complete the survey from industry, but not necessarily the local industry. It might be your principals that are completing this particular survey. And what they would also do is they would say in the area for implementation, they would say not implemented, but in the text, they would say, we do think it's implemented. So just to again brief the industry to say this is a very important the goal that we want to achieve as South Africa. And the next time this survey comes around, we will again engage with the industry just to again show how we actually implement these three guidelines within SAHPRA's guidelines, so that industry is also on the same page as SAHPRA with regards to the implementation of these three guidelines. And I think, Chair, that is all that I wanted to bring to the regulatory forum, just some feedback in terms of our meeting with ICH and some details we got about how the survey was actually completed. Thank you.
Thank you. And I guess, Dion, you then soliciting industry's support and compliance with these guidelines. And we will be modifying some of our current guidelines to make sure that we keep them current with some of the updates. I know on the E6, there's been some updates. There's now, I think, R3 that we will then be looking at and making sure that ours complies with that.
Yes, and I think it would benefit the industry, if SAHPRA or South Africa becomes an ICH member, it would definitely benefit the industry. So I am soliciting that collaboration, cooperation from the industry when we again attempt the survey. I think we will inform the industry when it's happening. Thank you.
Thank you. Okay, we're going to take a presentation from Pratibha.
Hey, morning, everyone.
Pratibha, maybe before you start, just want to say I do need to step off for 10 minutes or so to go address the staff on a wellness event we're having. I'll come back. I'm sure we're going to have a lot of questions around the backlog, etc. So when I do come back, I'll look at what we have in the Q&A and we'll assist you then with any questions around that. Thank you, Pratibha. Over to you.
Thank you. Thanks, everyone. I am presenting my screen, but I'm not able to see it. Okay, there we go. All right, so I'll be taking you through the business as usual updates for new medicines as well as variations. And we'll start off with new registrations. So this is a slide which most are familiar with, and I've actually cleaned it up so that it reads better. And from the previous RTF, where industry did request information on the number of applications that we are receiving in the various groups, as well as the numbers that are finalized. So now you see it reads as group. The period that we are receiving these masters, the number of masters that we have received in that group, the number finalized, the estimated approval timeline, and any comment that we can share up to group 15. And there's a reason for that as I move ahead with the presentation. So we are currently receiving applications in group 21, and that is in the period of July 2024 to September 2024. And we received 5 masters then, and none have been finalized. But if we start from the very beginning, which is the group 8, received between April 21 and June 21, 8 masters were received and 7 were finalized. And there is a delay with that one application. Group 9 received between July 21 and September 2021. We received 11 and 10 are finalized. Sorry, can you see my presentation? I'm just getting feedback.
We can.
Okay, thank you. Thereafter, group 11 received between Jan 2022 and March 2022. We received 6 masters, 2 are finalized. Group 12, between the periods of April 22 and June 22, we received 9 masters, 4 are finalized. Between group 13, we received 6 masters, 1 finalized. Group 14, that's between October 22 and December 22, we received 4 masters, none finalized. And group 15, this is between Jan 23 and March 23, we received 6 masters and 5 are finalized. Note that the estimated approval timeline is 360 working days. The total approval timeline does exclude the stop clock time, which is the time with the applicant, as well as the technical screening time. Then we move on to the biological products. And again, we'll be talking about groups 8 to group 15. Group 8, we received 8 masters, 7 are finalized. Group 12, we received 6 masters, 3 are finalized. Group 13, we received 3 masters and none finalized. Group 14, we received 1 master, none finalized. And Group 15, we received 2 masters, none finalized. Again, we are receiving applications we have applications up until Group 21 in the system. And that is 8 masters received, none finalized there. The estimated approval timeline for biologicals is 360 working days. And note that excludes the stop clock time as well as the technical screening time. Then we go to the biosimilars. For Group 2, we received, and this is between October 2019 and December 2019, we received 4 masters, 3 are finalized. Group 8, we received 7 masters, 6 finalized. Group 9, we received 7 masters, 4 finalized. Group 13, we received 4 masters, 1 finalized. And Group 15, we received 4 masters, none finalized. Biosimilars also track at 360 working days, excluding the stop clock time as well as the technical screening time. And we do have applications in our system up until Group 21. And then finally, the generics for Group 5, which is received between April 2020 and June 2020, we received 120 masters, 119 have been finalized. Group 7, we received 96 masters, 94 are finalized. Group 8, we received 140 masters, 137 are finalized. Group 9, we received 122 masters, 109 are finalized. Group 10, 129 masters received, 80 finalized. Group 11, 118 masters have been received, 27 have been finalized. Group 12, 76 masters received, 17 finalized. Group 13, 105 masters received, 18 finalized. Group 14, 72 masters received, 17 finalized. And Group 15, 76 masters received, 18 finalized. Generics, the estimated approval timeline is 250 working days, again, excluding the stop clock time as well as technical screening time. Now, I had mentioned that I am only discussing groups below 15, and that's because we have highlighted group 15 as the delayed approvals that we will be working on as part of a project to clear out this building backlog. We have identified 521 masters that we are working on in a coordinated manner. 466 of those masters have anything from 1 to 4 units pending approval. And 55 of those masters, we anticipate longer delays. These are masters that are waiting for on-site inspections, that are generics that have been submitted with clinical data that will then move on to a new chemical entity timeline for review, as well as applications that are already on track for rejection that have to actually go through a process for rejection together with the applicant. All right. Our strategy, as alluded to, we have identified the 466 masters that have anything from 1 unit pending to 4 unit pendings. We are working in a very coordinated manner within the different core functions at SAHPRA. We have socialized all the units to how we will be coordinating the activities. This will then allow us to balance the pressure of the registrations that are going out as well as the revenue that we do have to collect as well. We are correcting the misaligned allocations. So as it stands, we have naming and scheduling as well as inspectorate that are sitting in different groups that are still pending unit approval, whereas CEM and PEM are further ahead, and we have to try to bridge that gap in the middle. And if that doesn't happen, we will continue to build that backlog. So that is the pillars that we are working on at the moment. And this definitely involves a lot of collaboration between the HPA unit, who is the coordinating unit, as well as the different core functions. All right, so we started the project around September, and it was quite a slow start because we had to identify the issues that were causing the backlog, and this we have done. So just to give you the overview of the number of masters versus the approvals, when we started, it was 521, and in September, we moved down to 505 outstanding. In October, we doubled the number of approvals or registrations, and that moved down to 475. We feel comfortable enough to say that we will be tracking at an approval rate of 50 master applications per month. And if we continue at that rate, we anticipate to be done with groups 15 and below around June or July of next year. At the same time, we're very well aware that groups 16 to 19 will need to also start coming out of the system. So this again will be quite a balancing act on our end. So how we are moving now is with the 80-20 rule, we are utilizing 80% of our resources, 80% of our time on the groups below 15, and 20% of the time, as well as resources, are now currently also working in groups 16 to 19. In this way, we anticipate that we will stay balanced and clean up the groups 15 and below, whilst easily transitioning into the 16 to 19. Okay. So then we move on to the renewals update. Renewals is currently in phase 2. And I'll just highlight, just in terms of the approvals for the different phases since renewals commenced at SAHPRA. We have 18 approvals in phase 1 Q2, 13 approvals in phase 1 Q3, 14 approvals in phase 1 Q4, 4 approvals in phase 2 Q1, and 2 approvals in phase 2 Q2. Of course, we were unable to share the updated registration certificates with those applicants who have approvals on their renewals, and this is because we are still waiting on the fees to be gazetted. We now move on to variations updates, and we'll start with Inspectorate, and I'm just giving you an overview. So just in terms of the status updates for Type 1, variations received between 2022 and 2023, we received 710 applications. 421 of those applications are completed, and 289 of those applications are outstanding. For Type 1 applications received between 2023 and 2024, we received 1,133 applications. 56 of those applications are completed, and we have 1,077 applications still outstanding. For Type 2s, we received 162 applications. 39 of those applications are completed, and 123 of those applications are outstanding. Right, then we move on to variations for the PEM unit. A status update for this unit. Type 1A applications received via the FTP that are tracking at a 37 working day timeline. We have in process 69 applications. 625 of these are to be evaluated. 203 have been completed, approved, and 41 are completed with query sent to the applicant. For Type 1B applications received via the FTP with a 67 working day timeline, we have in process 79 applications, 636 still to be evaluated, 94 completed, approved, and 92 completed with a query sent. We also have Type 1A, 1B applications that are in the DVP, and they have 37 of 67 working day approval time, implementation timelines, apologies. We have in process 112 applications to be evaluated, none. 167 have been completed, approved, and there are 0 completed with a query sent. For Type 2 applications, which have a 120 working day approval timeline, we have 72 applications in process, 30 applications to be evaluated, 65 completed, approved, and 82 completed with query sent. And then with regards to responses, with a 37 working day timeline, we have 72 in process, 5 to be evaluated, 143 completed approved, and none completed with a query sent. We now move on to variations, CEM. Status update for that unit. For the type 1 applications, we have 71 rejected at screening, 258 rejected, 0 in evaluation, 423 to be evaluated, and 226 implemented or approved. For type 2 applications, we have 7 rejected at screening, none have been rejected, 48 in evaluation, 51 to be evaluated, and 51 implemented or approved. With regards to responses to type 2, we have 3 rejected at screening, 0 rejected, 37 in evaluation, 23 to be evaluated, and 56 implemented or approved. And then finally, an update for the biological unit. For the type 1A applications, we received 128 applications in 2022, 145 in 2023, and 59 to date in 2024. And we have finalized 123 in 2022, 75 in 2023, and 17 in 2024. For the type 1B applications, we received 144 applications in 2022, 155 in 2023, and 80 in 2024. We have finalized to date 136 of those applications received in 2022, 59 2023 received applications, and 13 in 2024. And then my final slide with regards to the type 2 applications, we received 111 in 2022, 139 in 2023, and 57 in 2024. And we have finalized 111 of the 2022 applications, 101 of the 2023 applications, and 16 of the 2024 applications. Thank you. I'll stop there.
Kaiser.
Thanks, Chair, and good morning, everyone. In terms of the complementary updates regarding the regulations, they are still with the Office of the CEO. She indicated that she's still applying her mind before progressing it. So the status as we are now is they are with the Office of the CEO. And the upcoming workshop, SAHPRA has undertaken that we will be hosting a CAMS industry workshop on the 21st of November. I think it's 2 weeks from now. Information is being shared with industry at large. I know that some letters have gone out to the different associations, and the SAHPRA Communication Division is busy with uploading the same invite on the SAHPRA website. I'm not sure if Melanie is here. You can talk about how far we are in terms of putting information on the website. Thanks, Chair.
Hi, Kaiser. We are almost done. The agenda has been approved. The invitation has been approved. We'll send out email invitations to industry today, and it will also be published on the SAHPRA website.
Dion, over to you.
Thanks, Mukona. So we're moving on to inspected and regulatory compliance. And I'll ask Daphne to just update the industry in terms of the pilot for the National Action Plan, some exciting developments happening there. And then based on feedback received regarding SAHPRA's activities around monitoring of advertising and promotion, also just asked Daphne to give the industry some feedback there and what we do and why we do it. And yeah, hand it over to her. Daphne, thank you.
Thank you very much, Dion, and good morning, everyone. I will just share as well. Mugana, if you can indicate if my slides are showing.
They're showing. Just put them on presentation mode, display, change of display settings.
Okay, do that. Okay, I'm using two screens. I think that is why. Too many screens open. Apologies for that. My apologies. I didn't know that I've presented so soon. To save time and speak to the slides. With regards to the substandard and falsified medical products, you would, for those of you who have been part of our webinars and also because you are part of the activities that we do ongoingly at SAHPRA, we do have a problem in this regard. And this does not only affect South Africa, it affects the region, Africa, and also global. And we have seen that based on the platforms that we are at, we all are faced with common problems. These are lifestyle, life-saving medical products that people find them easy. They are perceived to be difficult to access. So some would either be expensive and at the falsified ones obviously would be available at lower prices. So, and those that are unauthorized, those that are forbidden, the falsification market is capitalize on those. And some would be the substances that are permitted under strict medical supervision. And as one professor has said, they said, if you want to know what products are being falsified or are substandard, this would be, there are three words, which is happy, high, and hot. Everyone wants to be hot, everyone wants to be high, and everyone wants to be happy. So the happy part, it's a sensitive word. So, but in terms of examples, you would know that these are your, for example, at the moment, it's your GLP-1 agonist as an example, where we see a whole lot of emerging products which are claiming to be like either in the compounded form or they are being advertised online, or but they are made available to the public unlawfully, a number of them, and we are experiencing problems with that. Use it either for they want to lose weight, for example, and then also you would remember with the erectile dysfunction, they are using it for sexual enhancement, as an example, and also you would know with some of the psychotropic substances and narcotic substances, which are also being abused in the illicit supply chain, either falsified or substandard. And so as a result, we are working with various organizations globally, and that's how we also got to be chosen as the pilot for this National Action Plan. And WHO has appointed a consultant. So this will involve various stakeholders, and we will be introducing this pilot on the 13th of this month. And we would really appreciate your presence in that webinar. We have shared the link for registration for the webinar. The webinar will take place at 1 until 1:30. And we urge that you please join the webinar, because it will be information sharing by the country. So in the country, the SAHPRA will do the presentation of introducing this, and also will be discussing how and what role you will be playing. And also the Department of Health will also do an introduction, because this is at the interministerial level, and as it is at a national level, and obviously it affects various stakeholders at the highest level. And from private sector, as a very key role player, especially for working with us regularly here at SAHPRA, it is your availability and your active participation in this will really help a lot for the success of this, because if this pilot is successful, it will be rolled over to other member state countries globally. So WHO will be presenting this in an overview of what it is about and what it seeks to achieve. And South Africa obviously was, in terms of Africa, it is seen as a very key NRA in setting a standard for other regulators. But as you would know, there are many challenges that in our engagements with you that we have in terms of resources. So it will also assist to identify the gaps and see how together we can close those gaps or improve on those. In terms of the objectives of this National Action Plan, there are 4 objectives, which is to provide countries with a framework and tools to develop their own national action plans to implement the prevention, detection, and response strategies on fighting this product. Also is to provide guidance on how NRAs can leverage the competencies of relevant stakeholders like yourselves, policymakers, procurers, distributors, practitioners, patients, and consumers. The third one is to promote good governance and collaboration among multiple stakeholders with the interest topic, and who are responsible for regulatory oversight and who participate in combating substandard medical products. Fourth objective is to support the NRAs in achieving a stable, integrated, well-functioning regulatory system, particularly in specific aspects of market control, surveillance, and regulatory inspections. So The determinants of the success of this would be political leadership, your stakeholder partnership and technical cooperation across the sector, and investment in the regulatory system. The multi-stakeholder response required for this is that there be improved understanding and awareness of this at national, regional, and global level, strengthen the evidence base through surveillance and improved reporting mechanism, increase information sharing, optimize the use of analytical insight to design and implement initiatives, and lastly, to engage and coordinate among stakeholders to strengthen and sustain have a sustained system that combats these products. Where are we in terms of this pilot? So this pilot is meant to take a year. So following SAHPRA being appointed, the ministry did support SAHPRA, that SAHPRA be the lead agency, and also WHO, we had several meetings in preparation. And then now they have recently appointed the consultant. You will see him on the website. We'll be posting his profile. And we have done situational analysis, which I will just quickly go through it so that you can be aware of how important your role is in making this a success together with us. So we will be doing the sensitization webinar, as I said, in terms of situational analysis. So South Africa, when we look at our strengths, we have presence at the ports. SAHPRA in particular, there is a presence at the ports compared to other markets. And this for us is it's a strength because we are able to see what's going on and when we need to intervene. So although at the moment there are still some hurdles, but this is quite a strength from where we were. And then another strength is the informal relationship with the enforcement agencies and also with some of you guys. And we also have a strong regulatory framework that conforms to WHO ML level 3. We also have good relationship with international organizations such as the WHO, the UNODC, WTO, amongst others. We are well established in South Africa. We've got a well-established health infrastructure, well-established policies, structures, and roles, well-established and equitable access to essential medicines and healthcare. However, in terms of our weaknesses, we lack formal cooperation and collaboration in terms of like your MOUs with the stakeholders. For example, with the national prosecuting authorities, customs, police, border management authorities, amongst others. In terms of technological infrastructure for monitoring and reporting, unfortunately, we do not have, for detection, we don't have technologies to detect these, especially at the ports, since we import a lot. So this is one area that we are not doing well. And there is also poor vigilance capacity and reach, looking at how big our country is. We have limited resources to implement and sustain the National Action Plan as at now. And a lack of formalized strategy for communication on SF medical products to the public. The inability to assess the prevalence, whether it's attributed to stringent regulatory framework or whether because of our limitations on vigilance capacity, we are not aware of what the prevalence is. Informal market surveillance capacity, and I mean, all of us now are aware of what is coming out from the informal markets, whether food and also medicines that are sold in, for example, your spaza shops. lack of understanding of informal markets, lack of governance oversight on private sector stock availability. Also, poor PMS sampling and testing implementation capacity reach. As you know that we conduct post-market surveillance, sampling and testing, and at the moment our scope is still very limited compared to the market, how big our market is. And also the not properly mapped supply chain in this regard. So I'm mentioning all this. We are mentioning all these things so that you can also help us to strengthen them. In terms of opportunities, South Africa, we know we are political stability compared to many countries, and existing relations with international organizations and other stakeholders, active and availability of self-regulation by the supply chain stakeholders. So we appreciate, for example, the availability of the Marketing Code Authority and other associations that hold the peers accountable. So the use of advanced technologies, e.g. AI for prevention, detection, and response, active media for public awareness. That's our opportunity in South Africa. We've got, our media is very active, and I can say that we have a good relationship with media, although not always, but often we are. South Africa's geographical importance in the region as for supply chain, education and training to empower stakeholders on prevention, detection, and response, and also in terms of political buy-in in the MEC appointees. We believe that with these platforms that we have, we should be able to see a successful implementation of the NEP. And then in terms of the threats, unintended negative consequences following awareness mechanisms, because sometimes when you add education and awareness, there are those unintended consequences of actually the organized criminals seeing an opportunity. Insufficient reporting systems, and then the effect of macroeconomy on ability of South Africa to resource this, divided priorities of you as our stakeholders, and we don't have our own laboratory. We are outsourcing the services, and this is it's a limitation because it depends on the capacity of the lab and also our affordability. Monitoring the internet platforms that sells these products is a threat because these are they're transnational, and the slow legislative processes, and also our penalties can be a slap on the wrist. Lastly, South Africa's geographical importance in the region supply chain, and there is also a risk of infiltration of those products coming through the other borders from the neighboring countries. I think I will, what I just want to also add is that what we appreciate about our relationship with you is that there is always, in terms of our rapid alerts and recall system, we have been working very well, such that we would be able to timely and implement or enforce the actions that would be required, whether it's an alert or a recall. And another good example would be that of this is just one example, but there's many of those that we have published on our website. We have been working well together with you, and we were able to publish those. And this is in short with regards to the National Action Plan. So we just ask for your support and active participation, because we will need to develop steering committees and working groups, and it would be very good if we can have you helping us in leading some of those to attain the timeline so that South Africa can successfully implement this pilot. And that is all from the NEP. I don't know if there are any questions before I go to advertising.
Thank you, Daphne. They'll ask questions in the Q&A. So when you're done, you can just get to the questions in the Q&A. Yeah, so just a brief overview then to the industry in terms of our activities for marketing and our oversight of marketing and advertising by the industry. Thank you.
Thank you. Yeah. So with regards to the control of advertisements and marketing, for example, as we implementing this in terms of Section 18 and in terms of our regulations for advertising. So we have a focal person who is responsible for monitoring what is happening in the supply chain. So whereby we would conduct surveillance through either checking online, or we would visit some facilities just to check if, for example, establishments or community pharmacy, for example, how do they market, how do they promote products? Are they advertising products that they are not supposed to be advertised? We also would check the journals, for example. We also would use the complaint system that comes through to SAHPRA in order to investigate some of those. We do a proactive and also a responsive intervention when it comes to that. And so we also monitor the adverts and social media platforms, and we would therefore do the necessary interventions. So we have a plan. Maybe we may not have engaged you on how we are doing it, but I think we thought maybe it was just operational. But as we are implementing it, we believe that it's because we are doing it in terms of our regulations. So I'm not sure if I'm missing out anything beyond.
No, I think thanks, Daphne. I just think maybe the industry, and I did mention this to the industry the last time. We are looking at radio adverts, TV adverts, journal articles, what the adverts that you put up at the pharmacies and those sorts of things. And we are looking at it in terms of the regulations that we have currently. And that is the basis upon which we would review those adverts. And as Daphne said, it's both proactive as well as reactive. So somebody will report it to us. But we have to show that as an approach, as an ML3 regulator, just so that the industry is aware. If you do get any questions about one of your adverts or your promotional material, it would be because of maybe slight non-compliances to our regulations. Focus on our regulations. Thank you so much. I'll leave it there, Chair. Thank you.
Dr. Matiwe.
Can you confirm if you can hear me?
I can hear you now.
Thank you. So was requested to give an update. So I'll share a few slides. This is in relation to the regulations, how far we are.
as well as, let me just make sure I put the correct information first. And the feasibility study update.
Dr. Matibe, we can't see, but I'll share your slides if you like.
No, I have the slides in front of me. Thank you.
Okay.
I just want to make sure that, because I have my lot of stuff open, so I just want to make sure I don't share incorrect information. So just give me 1 second. I have it open, and then I will share. Okay. So if you may please advise me which screen am I sharing, because I have also multiple screen. The one that is showing the colleagues' faces.
It's blank right now.
Yeah, coming. I see it shows me that I'm sharing.
Yes.
It's the one that has P58 RPG on it, isn't it?
Yes, you just need to put it in presentation. Thanks.
Thank you. Yeah, I'll do that. And good morning again to colleagues. Yeah. All right. Okay. All right. So I'll share the feasibility, first the feasibility update, then the regulation update, and the other request was to share information on radiation control incident management. So I have shared the slides before. When we started the feasibility study, this is the slide that we shared with the industry. So I thought that will be very helpful to see where we are at and give update of what has transpired today. So I'm just going to start here. Q1, which was this year between January and February, we did publish the expression of interest. It was approved by the CEO in January, between January and March. And by end of March, beginning of April, we did publish the expression of interest. And after we have published the expression of interest to date, we have received 16 applications and we did engage the industry. And we worked on various guidelines which we published with the expression of interest. And as we have indicated, this will be working document. So the outcome of this is that we have received, so now I'm going to stand here. So we have received 16 applicants that have shown interest in the study, and out of the 16, 14, 2 has withdrawn, but 14 of organization has indicated interest in continuing with the study. We have furthermore engaged conformity assessment bodies to support in the study, and from there we have received, we have communicated or engaged 3 international conformity assessment bodies which were interested in the study, as well as 2 local conformity assessment body that also wants to be part of the whole project, and we have involved SANAS in that process to support our local conformity assessment body to be accredited to be able to do such. And one of the local conformity assessment body as well, but also has accreditation with the ILEC, so want to be interested in the study. So in total, we have 6. We also have, we engaged, because out of the 28 products, so it's 14 companies now with about 28 products. We only received products that are imported into the country. So what we further did, we engaged some of the local manufacturers that we are aware that they are manufacturing the product of interest. We've engaged, and then we are still continuously engaging with them so that they can be part of the study. Because the whole intention is to look at the whole process holistically and looking at the impact of local manufacturers as well. And then now between June, since we have received the expression of interest, we have shared the acknowledgement letter to also indicating that we agree or approve the participation of the applicant into the study. And we were also working with our IT unit, where we have now last month trained the interested or on the FTP process, where the applicant will be submitting their information, then the team will start working on it. So if we're looking at the July, we have also initiated internal processes on how will we receive when we receive the application, how will we do screening of the application as well as review of the application. In this process, at the background, we are also sourcing support from some of our sub-stakeholders that are important, such as NHLS, to support in reviewing performance evaluation in certain areas. And I think I just need to indicate, we have indicated previously that we are pushing it in a reliance model approach. It was the local manufacturer as well that we wanted to see how will the caps work. So we'll see the outcome. As I indicated, we are now receiving, we have shared a communication with all the applicants that the portal is open, the FTP is available for them to start submitting their technical dossier until next year, January 2025. Some came back requesting extension because compiling the technical dossier in most cases is new for them. So we will communicate up to when can we extend them, finalizing, compiling. We have received about 2 technical dossiers for review, and the team will start looking at that. We have SOPs already in draft form, so we are validating all those SOPs as we go along. So, and once we have, because we have only received the technical dossier now until January, and we are updating our SOP, so this will definitely shift, but I do not think it will affect the proposed date that we have put it ahead. But that's exactly where we are at the current moment. Okay. Next slide is on the regulation. So this is to give you a high summary, and I will stand on this block for a reason, because that's where we are at now. We have sent out last year, August, the second round of the medical device regulation publication review based on the amendment changes that we've made, and we were clear on which areas to be commented on, and the guidelines, the regulations were published for a period of 3 months. We received feedback with the comments from stakeholder in February this year. Internally, we collated and started responding on the comments that we have received between February and January, and then we shared it with our committee for their review and update, as well as sharing their input. Based on that, we then updated all the responses that we have received, and then shared that with both internally. We had a team that consists of our legal committee, medical device committee, and ourselves internally. We reviewed it between September and October. We have finalized that, and what is happening now, legal committee requested to review the document in totality. Upon receiving their final comments, then we will share the document. So we are here now. So this is done. So legal has requested to look at the document before they can release for us to submit to our expo, and the intention is to submit the document before end of November. And once Exco has released it, then we'll submit to the National Department of Health for Gazette. When we're looking at radiation control, we fortunately had our meeting last week, our unit, our program RTG, but we have informed the team that we'll have the radiation control RTG, and we'll communicate early next year so that we can have members participating. And one reason that the CEO has spoken about this before, but one of the reasons we are delayed, we hope that by this time we'll have a radiation control manager to support in ensuring the structure and also supporting the team with the structure of the RTG. So hopefully early next year. If not, I will then have to support in establishing the RTG and supporting it. But we were hoping that for end of this year, we'll have our RedCon manager to support me with the management of this of the committee. And then again, because the update that was requested was on incident management, we have done the guideline, and we have shared the guideline with a regulatory radiation control advisory committee, and the committee have shared their
responses, and upon that we have to publish it internally, take it to our various various committees, including our policy committee, and then we'll publish it for public comment, and then we'll implement afterwards. So one of the points that was raised, and this we have actually engaged with the IAEA to see how they also publish incident. What we have picked up is that there is a platform that we communicate with IAEA, and we actually now have to report all the incidents that are happening in South Africa in that platform, but they are also not publishing. So we have discussed that perhaps we can, if we're going to publish, this is the list of information that we can publish on the different incidents, and this is open for any comments, and we'll go back and discuss with our technical advisory committee moving forward, because this is one of the points that was raised previously. But to date, since this year, we have received a total number of 11 incidents, and when did we receive it, and the type of incident that we have received, and the closing date. And I think about 2 days ago, we have received a general one from an association indicating that a lot of practitioners are using in the dental environment are actually using X-ray machines that are not approved, where we have not given permit as SAHPRA. So we are now working with the healthcare professional regarding the professionals who are using such equipment without, they're using it illegally without the permission or the approval from SAHPRA. So with this one, we are urging, because some of them we get it through the whistleblower, so we are urging and encouraging the industry to support and even speak to the association members to report any illegal use of equipment that are emitting radiation anyhow to us, so that the team can do investigation. Thank you. I think this will be the last slide. Thank you very much. Over to you, Chair.
Thank you, Dimakato. I don't see questions in the Q&A. Just to encourage the participants, if you've got any questions, please use the, okay, I see a few have come through over the last few minutes. Okay, so Dimakato and the team will look at those and address those. Okay, so you've also covered radiation, I see. Okay, so I'm just trying to look for questions that, okay, good. All right, thank you. So yeah, we'll take the questions on the chat. If we could then move to Dimakato, did you also cover the adverse events guideline? I came in when you were presenting.
Oh, no, they were not on the agenda, but I can give a brief. Priscilla is on the line on how far we are in publishing. We are done with that. Priscilla, maybe you can come in quickly and support, because I think my understanding is supposed to be with communication for publication. So Priscilla, can just please assist with confirming that.
Good morning. So in terms of the medical device adverse events guidelines, we have 3 documents. So the intention is to publish before the end of November. So all the documents, we have received the comments, collated, went through the internal review, and we are now at the last stages of the approval process. So we should be able to publish by the end of November 2024.
Okay, thank you, Priscilla, for that update. Okay, just want to see if Bongani is here.
No, thank you. He's attending a legal meeting.
Okay, I can speak then to this item. So thank you everyone for the inputs that were received on the draft BEE policy. We have looked at those and addressed those. So we will then be finalizing the process internally, and we hope that before end of our financial year, which is end of March, we will then publish the BE policy for implementation. Will indicate exactly from when it will be implemented, and it will also come together then with a guideline from inspectorate, because if you remember, the first phase is that we collate the BE certificates, or if you don't have one, it would be the affidavit. So the first phase is really just collecting that to enable us to conduct our analysis. So we'll make sure that we give you adequate time to make sure that when you then submit, you submit with that information. Remember, this policy will be applied prospectively. So anything that's in the system now will continue as it is, and we'll communicate very clear timelines. Okay, but that would be before end of the financial year. But thank you so much for the inputs that we got. It was quite a bit, actually. Okay, so thank you for that, and then I'll proceed. I know Kristalna is just busy in other workshops. So I just want to check if Kristalna is here to take us through the IT upgrade. Okay, she's not here yet. Mukana, can you just nudge Kristalna, please, in the other meeting to join? I'm happy to take the item 10. If Rahad, him and I were in this engagement I was in, so I'm happy to speak to the matter of the fees. We agreed that I'll touch it. Yes, he's not here. So on the publication of the fees, we had to share this with the National Treasury, and it had to then be reviewed also by the Minister of Finance, who we did share these fees. If you remember, we got your comments early in the year, we addressed them, and then we had a workshop where we spoke through those, and then we were ready for implementation, but it had to go through National Treasury first. So it's gone through that process, and we've now received sign-off from the Minister of Finance, and we expect that the new fees will be gazetted hopefully before end of the calendar year. So we're now really in the administrative process of the Department of Health just gazetting these now that we've got approval from the Minister of Health to then Minister Motsoaledi. So yeah, be on the lookout for those, but we do expect before end of the calendar year that these will be published. Okay. Right. So Mukona, is Kristalna here or not yet? So I'm gonna ask then that Mukona, when she joins, you just let us know. Go ahead. I see you're unmuted.
I'll let you know as soon as I've confirmed that.
Okay, thank you.
I'm just checking with them.
Okay, Melanie, let's just see the next item, and then I think what we will do is we'll open the meeting then for questions. Yeah, let's open the meeting for discussions. And then when Kristalna comes, we'll pause and take her presentations. Okay. If you have any questions, please raise your hand, and then the team will unmute you. So I'm just looking at the list. Please raise your hands if you've got questions for us on any of the topics that were covered today. Okay. I see a hand from Claudia. Let's see if we can take, it would be good to take a set of, say, 3.
Hi, can you hear me?
Yes, go ahead, Claudia. I don't see other hands, so over to you, please.
Thank you so much. Thank you so much for the presentation. It's been very informative. Just a question around the Section 18A and Section 18B exemption that's due to expire in December. Is there an update on that, please?
Okay, thank you for that question. Dimakato will speak to that. And there was another hand that went down now. It was someone Letswalo or something. Yes, please go ahead,
Yeah,
Angelina.
hi. It was the same question. I have it on the chart regarding Section 18A and 18B, since the regulations haven't been finalized, but this one will obviously have an effect.
Okay, thank you.
Yeah, okay.
Great. And then let's take Nicola and then Dimagato and whoever else will ask you to comment.
Thanks very much, Tumi. I just want to ask, and you didn't mention this, but just want to ask where SAHPRA is in terms of the guideline on traceability of health products that went out for comment. Be helpful to know where we're at with that. It went out in June. Thank you.
Okay, we'll have Kristalna speak to that. I don't know, unless if Pratibha, if you can do so. If not, when Kristalna joins, she can speak to that.
Super.
Okay.
Thanks so much. Appreciate it.
Thanks. Dimakato, over to you, please, on the exemption.
Thank you. I think I saw Nicola. I think it's Nicola who was talking now. He has actually answered the colleagues online and supporting. Thanks for that. But we have already submitted the Section 18A and 18B to the National Department of Health end of October. And yesterday we followed up with them because we did have an engagement, and this will be one of the things that they will focus on as they are aware that agent. So this was submitted in October already. So in our meeting with the NUH yesterday, they said they will address this urgently. I'm not sure if CEO will allow me with the traceability, unless Pratibha can support, because I know that it's currently, we are currently internally reviewing as well with the comments to see if any comments related to various departments and support in our unit. And I think after that, the CEO will then collate, because we are assisting with the responding to comments, unless Pratibha has something different, but it's currently collating. I received it earlier this week for review. Received earlier this week for review. Thank you.
Thanks, Dr. D. Yeah, thanks, Dr. D. That's correct. It's currently circulating. Where we're reviewing those comments as well from industry. Kristalna is actually on the call now, but I do know that that traceability guideline will be workshopped once finalized internally. Thank you. Thanks.
Thank you. Maybe if we could also just take a few questions here on the chat. Pratibha, for you, and you may have spoken to this, Eric is saying there's misalignment where you have CM and PM having completed, and then NNS and Inspectorate only starting to allocate. How are we planning to address this misalignment? You may have spoken about that in the presentation, but I don't know if you want to make a comment, Pratibha.
Yes, that is actually the whole crux of the backlog, Eric, and is actually what I did highlight, that the units are working at a different pace, and that is what we're trying to bridge the gaps between the units so that we can move in parallel and have one registration at the end instead of you receiving an approval, for example, for PIM and SIM, 12 months before you receive an approval for naming and scheduling an inspectorate. So that is what we're working on as SAHPRA. Thank you.
Thanks, Pratibha. And then Nicole says, can they get an update on localization? So that one, there's a draft policy that's out for comment. I'm hoping you've seen it and that you comment on it. And then on harmonization, it's not clear for me what you're asking there. So if you could ask a specific question on that, but you know that we are part of Zazibona, so we do participate in those reviews. There is currently a pilot running at a continental level, wherein we also are participating in that. But Nicole, if you could just clarify number 2, and then number 3, again, I don't know what question you're asking there. I'm not sure what update on resources and capacity use you want us to speak to there, so clarify. And then on, I think you probably mean, I don't know if you mean AMA or you mean AMA-RAGE. Again, I'm not sure what is required there. So maybe let us know, like, are there specific questions you want us to speak to, right? Because it's a bit vague the way it's written here. But I can just briefly say, Yeah, just give me is that Nicole?
Okay,
Yeah, just
so
give on AMA, I can give an update on AMA. So the board was appointed, the African Medicine Agency board was appointed. They have advertised the role of the DG, and I think it closed sometime in October. So the intention is that they'll shortlist and interview soon. But in essence, the AMA-RAGE pilot that's running, it serves as a good foundation for AMA. So we are participating as SAHPRA in that pilot, and post the pilot, the heads of agencies will just take learnings from the team and then have a way forward, but also share their learnings with AMA. So that's what's happening at a regional level. I know a number of you are or at least a number of companies are participating in this continental review process. Thanks. Nicole, you want to clarify 2 and 3, please?
Yes, thank you very much, Madam CEO. So these questions actually come from Stavros, who was unfortunately able to attend the call, and he's asked me to ask them on his behalf. I think when we talk about harmonization, resources, and capacity, he's talking, from a high-level overview. We know that the regulator has been struggling with resource and capacity, and it has impacted on timelines and backlog. He just wanted to understand if there is any update there and if there's any good news in that regard. And on the harmonization, I think you've covered that in terms of SAHPRA's participation externally, which is good, and also from the African Medicines Agency perspective. So I can certainly give him that feedback. Thank you.
All right. Yeah, thank you. Yeah, so yeah, I mean it's open that and it's not unique to SAHPRA that we do struggle certainly with being under-resourced, and hence we need to look at other efficient ways of doing what it is that we do. So you'll see in future we'll be engaging some of you on some of the AI pilots that we want to implement, because we do recognize that AI can assist us a lot, particularly in some of the more kind of administrative tasks that do take a while. So there's a whole strategy that we've put in place for AI, and we will then be running pilots over the next few months. So I really hope we'll get your support as we do that. Yeah, and we've also been fortunate in that we've had a number of philanthropic organizations funding some of our programs and some of our work and some of the resourcing. So that's helped us a lot bridge the capacity gaps that we've had. Okay, thank you. Christiana, I'm going to take 2 more questions, and then we're going to hand over to you then to give your presentation. I'll take a question from Nikki. It says, I know our RMPs are not on the agenda. However, is there an update on when industry can expect the RMP guideline? I'm not sure who will speak to that. Dathang, no, Sobaran is not here.
No, it's fine. It's fine. As your PV will speak to that.
PV will
Mafura, just a quick comments, please.
I'm not. Is Flora here?
Yes, she is here, Chair.
She's not hearing us. Oh, she's. You may be muted, Flora. Maybe just nudge her on the side. We'll take the next comment. And then we'll pause for now. Let's see. It looks like this was addressed. Let me see. And then Sarah was asking when the localization guideline will be published for medical devices and IVDs. Yes, as we've indicated, that will be done post the feasibility study, because there's a lot of learnings we will pick up from the feasibility study, but certainly it will be done once we have those insights. Okay. Thank you. Flora, Dothang, are you guys able to comment, or can we move to Christina? Then we'll come back to this question.
Let's move, CEO. We'll come back.
Okay. All right. Christelle, now over to you, and then Nikki will come back to your question.
Yep, thanks, Dr. Tumi. So I think I'll just very quickly run through some slides and give a verbal update. If there is, I think, anything else that we're doing from an digitalization process or rollout perspective, just to remind colleagues that we will issue industry communications as we have been doing in the past few months. And also as we then have specific milestones that we reach, that we will then be running those webinars. And for the colleagues that have missed any of the webinars that we have had in the past, especially the most recent one around the portal that was towards the end of September, that those recordings and presentations are still available and accessible through the SAHPRA website. So, Chair, if you'll bear with me then, very quickly running through this. Let me just put this on slide mode. So I think just reflecting maybe then the reasons why digital transformation is such an important strategic imperative for us, and why a lot of focus and attention is being given to this at the moment. And I think also appreciation for our funding partners who has enabled us to then start this digital transformation, supported SAHPRA. I think primarily for us, efficiency and effectiveness, as CEO also points out, with some of the deployment of the digital tools, we know this is something that is it's almost considered par for the course. We see the efficiencies already. We can see the effectiveness of our controls now around managing business processes and having these software tools support the governance and the validation of data coming in. From a transparency and accountability perspective, so already internally, we are seeing that I want to say positive element starting to roll through in allowing us a better view of all of the data that we have, and how to also use some of the information that is now coming through on the reports to plan and deploy interventions in a more timely and more effective way. Also from enhancing the regulatory compliance, so this has been very helpful using a software tool and the revised ECTD 3.1 guideline, as well as the validation, to ensure also that the quality of the submissions and the information that gets submitted to the regulator is of higher quality. And that then will contribute to the fact that we will have less interruptions during our evaluation process, with applications having to be stopped, taken out of the queue, queries to be sent. We wait for those query responses to come through in order for us to then bring it back into the work process. And that stop-start obviously causes some efficiencies in itself. So therefore, big plus for us is that we've got enhanced compliance. As I said, also then having access to this data, allowing us to make data-driven decisions. And the nice thing that Dr. Tumi has mentioned is also facilitating some innovation. So even looking at now bringing in some AI tools that can help us with some of the administrative processing, whether that is just checking content and content compliance, and not just that, an attachment is there, but actually that we've been receiving the right attachment or the right information, helping us to run through that just a lot faster. I think the key considerations, and these were things that we looked at before we started the digital transformation process. It's still very valid and relevant to us where we are now, is ensuring that our infrastructure and the connectivity then supports the deployment of all of these software tools. That we also look at capacitating and doing additional training with staff members. So as we then deploy some of these software tools, that we bring the internal stakeholders along with us, So making sure that we also have some additional resources in ICT to do the application support. And this is really quite critical because, I mean, invariably things get stuck or something doesn't exactly go according to plan. And therefore, our ability to react and respond quite quickly to the queries is really critical. So bringing in some additional capacity there, application support specialists, and as I said, just making sure that we do as much as we can with regards to reaching out with different training interventions. The data security and privacy, I think this is really something that is very much top of mind, not only for ICT, but even for our risk audit and governance board committee and the board itself, ensuring that as we digitalize and deploy more and more of the software tools, more of the data then being possibly vulnerable to hacks or breaches, and therefore ensuring that we have a very good investment in tools as well as then regular checks, vulnerability assessment, penetration testing that happens. And recently we've made a decision to increase the frequency of the VAPTs from an annual to a biannual cycle to ensure that we really make all effort from our side to keep the data and the intellectual property safe and secure. I think the other thing is also around stakeholder engagement, so internal as well as external stakeholder engagement. As we discuss the tools for the custom development, as we then do the business process mapping, the planning of functionality, and now as we are starting to get out of the development cycle, getting into user accepted testing, making sure that we also bring in some of the external stakeholders into the portal launch specifically, where we're doing something quite different and quite new. So that would be good to then have the participants give feedback and make sure that when we then launch the new portal functionality 1 April, that we are ready and that we have ironed out hopefully most of the bugs. For regulatory harmonization collaboration, so I mean, just reflecting on that question that was asked, what are we doing? So this is another item that is also quite key in our considerations, is how our ICT environment and the different tools that we use also then support harmonization efforts. One of the things that is critical in the development of the portal has been how we can also use data standardization practices, introduce and implement controlled vocabulary, using, I think, references for I think for the pharmacovigilance tool, specifically things like using MedDRA ontology, where we've got, for instance, in the application process, looking at introducing and linking up the WHODD. So there are different things that we are doing also to start aligning, I think, from a global best practice perspective. And this also, even when we do updates and changes to our ECTD specifications, that we are being mindful all the time around what is happening around us and what other NRAs are doing and what is considered best practice globally, and trying also to align SAHPRA with that, and preparing ourselves for that eventual and inevitable change over to ICH 4.0 in the next 4 or 5 years. And I think, yeah, the main thing is just inclusivity and accessibility that underpins, I think, the development, making sure that the user experience, both internal and external, is seamless, and that the applications are easy to use. And the benefit in terms of the efficiencies and the transparency with data then rolls through both to SAHPRA themselves, as well as then having the ability from an applicant perspective to manage your own workflow and transactions that has been submitted to the regulator. So just, yeah, I think on the data standards, one of the reasons why this is something that we're very seriously pushing now is to make sure that with the applications that we're deploying, that they're interoperable, efficient, that we have data consistency, and then the transparency that comes along with that, as well as the fact that, yes, it is something that allows us to harmonize with other regulatory authorities, and also for some of the data, I think in terms of content reuse and so on, that's becoming quite important for us. Right, so I think some of the important things that we need to start at the right place, and we have to start at go, is just making sure that we embark on this cleaning up of our health product registration information, and adopting and introducing then IDMP RPI. And as I said, they're also using controlled vocabulary where it makes sense, and then different ontologies that we will access to start cleaning up data, standardizing data, and normalizing it with what is also accepted globally. I think there was a question just when I joined around the GS1 barcoding or the traceability guideline. I hope I understood right. But I think where we are with the traceability guideline. So in 2017, I think the first communication was issued in the Government Gazette by Dr. Gavin Steele around preparing for implementation of barcodes, data matrix QR barcodes on health products. And there was a information in terms of the structure that was provided. And since then, we know that a lot of applicants have started the process in preparation for this change when it comes. And we then recently have had some engagements with the NDOH and various stakeholders within the NDOH to now start moving this forward. It is also an item that features very much under Pillar 2 of the new Presidential Health Compact that was signed in August 2024. So this is really an important intervention for us. For the guideline that has been published, we've received a good amount of communications. Internally, we've started that consolidation and review process. We've made some provisional updates to that guideline, and we are now getting into a process where we will have an internal workshop of the updated guideline, and thereafter then re-engage very early in the new year with the stakeholder being NDOH, so that we can then finalize and then set a date for an industry workshop, very much the same way as we did with renewals, just having those engagement sessions to go through the updated guideline, share that back with industry, and then hopefully we can get that finalized and publish that in Q2 of the new year. That kind of talks also to the GS1, the track and trace is then something that kind of like goes hand in hand. There's a lot of activity around substandard falsified medicine management, looking at enhancing patient safety, and that also in a bid to then support local manufacturing. So with this, we will also look at a process and start consultations around how we scope and build a data structure or a application to manage then for not only because it is important for us, but also this is something that even for our WHO GBT journey, it's an important item that we want to address, is to make sure that we've got this database and data structure that will, at a first level, assist us to look at product batch quantity information, and at a later stage when I think also we are good few years into using GS1 barcodes, and we've got alignment with the systems also in the NDOH NHI, that we could possibly then start introducing that first level and second level of serialization into that data structure. And as I mentioned, the implementation of controlled vocabulary and data reference lists. Right. So I think for us, as much as we're doing this for SAHPRA and to improve the effectiveness and efficiencies here at SAHPRA, we also bearing in mind that there is some benefits for digitalization also rolling through on a continental level, making sure that we then address these items in terms of improved access to medicines. Very important around enhancing pharmacovigilance. So this is really important, as you can imagine, standardizing data and how we use data and collect adverse drug reaction and adverse events following immunization events, how we can then share that information, the anonymized information at signal detection level then with other countries in the continent to enhance then patient safety. And we've spoken, I think, at length around how this will also facilitate then continental and regional collaboration, and then can support other public health initiatives, like, for instance, the data sharing around the product health product register with the NHI. I won't go through the roadmap. I think this is on the website. And maybe then just very quickly, the last one is to just reflect on some of the things that we have been busy with over 2024. As you know, the implementation of the internal health product application management system, DocuBridge, to assist us with the document management, lifecycle management of our health product applications, and that this is currently looking at our category A, orthodox and biological medicines, and will then also accommodate our other health products when those registration processes then start. The SAHPRA engagement portal, we have had that webinar recently. We're doing some testing with the focus group on site here at SAHPRA with 8 applicant companies in that first week in December. We also, with the NDS7, the team is busy with the upload of the master data into this particular tool, and this is for managing import and export applications for narcotic and controlled substances. So we will be completing the master data imports and then run through internal business testing. So we'll be running a parallel process internally. And then again, early in the new year, the plan is to invite a test group of applicants to then submit their permit applications online. And once we've completed the testing with the internal applicants, again in Q2, to actually then roll this out for other applicants to start using. There is some a project that we will also start for developing a pharmacovigilance platform. So to ease the data collection from applicants, that information can then come through standard XML files and be shared with us electronically, and the same integration then also with our Med Safety app as an integration for data collection, allowing then also that information to come into a workspace where the colleagues in PV can do the case management, and we then have our signal detection software that can sit on top of that. And of course, the ability then to publish some of that data and some of that information onto the website for pertinent or relevant information that we want to share, but also then allow the team to have access to more robust reporting. Clinical trials management and RAISE Plus, these are also 2 items that is in configuration at the moment. And I think hopefully we will have for radiation control, the RAISE Plus going live by the end of the year. So also in early next year, they can actually start using the software tool. Clinical trials management, we are currently in development. So we've done a pilot previously with a small test group, and there were quite good feedback and inputs provided in terms of additional features. So that's currently in rebuild, and we hope to also then start engaging industry to run another pilot with us very early next year. So busy 2024 and definitely going to be a very busy 2025. Thanks, Chair.
Thanks a lot, Christina. I think you've certainly covered quite a bit. We're going to, I think let's open it up for questions for Christina. We can take questions and then we'll come back to the Q&A. We're doing on time. Yeah, okay, we've got time. Let's take some questions for Christina. Let me look at the hands. Any questions on this update? Okay, good. Looks like it was all clear, Christina. Huh? Awesome. Okay.
It makes for a nice change from my side.
All right, let's see. Yeah, you're right. So nothing
Chair.
yet. Okay. We'll go then now to the Q&A. Just go back to Doslang and Flora. You guys, Doslang, is Flora here to take that question or will you take it?
She is here.
I am here,
but-
CEO.
Oh, I see.
Okay.
Yes.
Okay, my apologies about earlier. So regarding the RMP, we are still in the process of finalizing the document. So due to my absence from the office has actually delayed some of the activities. So this is the activity that I'm actually giving priority at this point in time. So I believe by the end of this calendar year, I should be able to publish the final version based on the interactions that we had with industry from the workshop we held in April. I'll post their CEO for any further questions. Thanks.
Thank you. Thanks, Flora, and welcome back.
Thank you.
We will take another set of questions. So there was a question from, this was covered though, Frangelina. So Frangelina says 18A and 18B was the submission to pricing committee focusing on extending the exemption or outlining prohibited acceptable practices. Dimakato, do you want to talk to that?
Responded that we have submitted. Yes. Sorry, ma'am.
Say that again, Dimakato, I
CEO,
didn't hear it.
you hear me? Oh, yeah, I'm indicating that we have already responded with Section 18A and 18B. Section 18C is managed by the National Department of Health. Thank you.
So did you, however, get the question? I think the question is slightly different.
I maybe Frangelina can assist us in clarifying it.
Yeah, thanks, Dimeka. So I wanted to find out, you said you made a submission to the pricing committee. So I wanted to find out whether the submission was to request a further extension of the exemption, or because it's that exemption comes up with, there could be prohibited practices or acceptable practices. I want to find out whether it is to let them.
So we didn't make a submission to the pricing. Okay, we didn't make an
Okay.
exemption to the pricing committee. The exemption is for the minister to approve, and it's an extension of the existing Section 18A and 18C. Yes, thank you. Is that clear?
It seems like it is. Thank you. Let's
Thank you.
proceed. And then, sorry, should have to find the others. Okay, so there's a question from Lydia. Will there be a separate country-specific fee for Zazibona products submitted through the new process? No, we haven't discussed this at all. So for now, the status quo remains. I know Zazibona is piloting, has a pilot now that includes fees, but as we stand, our SAHPRA fees remain to be SAHPRA fees. Okay. Then there's a question from Ceci. Feedback on borderline product guideline. I thought this was finalized a while back. Traceability we've spoken about, right? Borderline, I think we spoke about it a while back and Khonse responded and I think it was going to be published. Khonse, I don't know if Hans is here. Unless she's on training. We'll come back to you on this.
Chair, just to speak on
Yeah.
this. Oh, okay. Can I
No,
speak
go
to
ahead. I wasn't sure if you're here or not.
Oh,
There's many people
okay,
here. so,
thank you. I did respond in the chat to indicate that borderline, I'm currently in the committee meeting, the legal committee meeting, and it is an agenda item. So post it coming back to the SAHPRA working group from legal, then we will implement it. But it's on its final stage, and that is what I was indicating in here. Thank you, Chair.
All right, thank you. Yes, I see that you've responded. Apologies, I didn't look at that. Maybe I should actually look for responses. Okay. Then the next one is from Mel. Can we get an update on when we can expect to see the updated schedules, which include Schedule 2 substances that can be advertised to the public? Dotlan?
Thanks, Chair. We have actually finished with looking at public comments, and we took it to the department, and they also had their comments, which we have looked at and finalized through our committee process. So the act has gone back to the department for publication. Thanks.
Okay. Do we know when it's going to be published? Okay, so just follow up with them, please, and then maybe give us feedback. It can then be provided at the working group, yeah?
Sure.
Okay, thank you. And then Shemaine, I see Pratibha responded to your question, so that's fine. What's the next one? I'm just going to take a few and then we'll open up for comments. Let me just see how much time we have. Okay. Then there's a question here that says, how long does it take to receive a free sale certificate after requesting it? I know we get these a lot for devices. Dimakatso? I know even in other areas, so maybe Kaiser may also want to comment. Dimakatso? Or Kaiser?
Yes. Thank you very much, Chair. So it usually takes us a period of 4 to 6 weeks as we go through various internal committees to review the application, but at least 4 to 6 weeks. Puselezo can confirm that, but I know within 4 to 6 weeks. Thank you.
Okay, thank you. And then Amanda, I see your question has been responded to. Jabulo, your question has been responded to. A few. Gina, your question has been responded to. Okay, we'll take 2 questions and then open up for any other questions. So, Dosang, this is for you and Flora. PV platform, will this be a validated system? Can applicants be users for visibility on signals and add possible signals or safety trends? So I guess it's for you guys and Kristalna. Then the second one, as you apply your mind to that, okay, Pratibha responded to Nisha. Okay, so that's the only other one I'm seeing. Oh, sorry. Then the next question from Alzima. I just have a directory query for Kristalna. Can I send an email? Yeah, I think you can send an email to Kristalna. Kristalna, if you can put your email on the chat or send it directly on the chat to Alzima. Elisma, I'm sorry. Elisma, apologies for butchering your name. I'm really sorry. And then Michelle. So there's a question there, numerous questions below for CAMS, for the CAMS unit on the 3D list process and the delays in variations and no responses. Let's see. Kaiser, do you want to speak to those? They probably came through when I was not here. Kaiser, do you want to talk to those? Is Kaiser here? Okay, we'll just follow up with Kaiser on this one. If someone can just nudge Kaiser to speak to these. Okay, Dotlan, Christina, Flora, do you want to comment on the PV one?
Yes, Chair, it sounds a bit technical. I understand the question to be asking whether the portal will be interactive with the public. If there's a correct understanding, I think I'll defer to Christiana and Mafora,
Yeah.
because I don't see how that will be possible, though, in terms of control. Thanks, Chris.
Thanks, Tochlang. So, yeah, I mean, maybe just a bit more clarity around the question when we say interactive with the public. I'm not sure what that means. Does that mean that because for any person that wants to engage with SAHPRA, they can actually create a user account, either as an organization or an individual. And some of the functionalities that will be introduced in the portal is also to allow queries to be logged by a person and then be submitted to SAHPRA and routed obviously internally based on the nature of the inquiry and which area of the business it needs to go to. So if it's related to that, then I think yes, we obviously will have through the portal people can access information or request for information or request for service. But if it is around collecting ADRs or IE fees, that must be done through the Med Safety app. So also when we then have this general inquiry functionality deployed on the portal, there will be a pop-up that says if your inquiry relates to an adverse drug reaction, side effect, or adverse event following immunization, please log onto Med Safety app to log your complaint. And that then takes them directly to Med Safety. So if that makes sense and that addresses then the question, I trust that it's clear. Thanks.
Okay, thank you. All right, so let's we can open this up for questions then. Does anyone have a question to ask? But maybe before we do so, can I just confirm, is Kaiser here? Fonse Mogana, will you just check with him in the background? Because I see he's here, he's connected, he's not in front of his computer. Please just chase up on him, okay? So we're going to take some questions. I see hands. There's a hand from, is it Leith?
Yes, thanks, Timmy. Just a question for Christelna. So while we're still on the PV portal and the PV platform, I think maybe the question might have been coming from a perspective. I'm not 100% how the whole user vigilance database works, but my impression is that marketing authorization holders can pull data from it, you know, so like you could essentially pull a report of adverse events from the entire, in our case, it would be country, for all products with the same active ingredient as yours, that sort of thing, without, you know, identifiers or even product names, but for that API. So would the PV portal have that sort of accessibility where we could essentially, similar to like what you can do on Vigibase through Vigi Access, you can go and like see the numbers of cases. That might be something that industry would find valuable.
Yep. So Chair, just through you, let me respond. So that would be the intention. So I think also just the way that we would want to manage ASPERS and then provide information around some of the signals that's being picked up. So with the enhanced reporting and dashboarding, those would be elements that we would look at. So what information we will then expose, you know, to external parties. what data they would want to consume, and then versus the information that we will obviously be using internally. So the anonymized information at then an aggregate level is something that we are looking at. I think one of the key requests from Flora around the system functionality is also then to allow them to manage ASPRs a lot better. So for that link then between the health product registration database and all of the information that we're picking up through the PV system. So I think probably when we get into the scoping discussion, what would be useful, and I'm going to make a note of that, is maybe to have a round of discussion also with industry so that we can invite input and comments in terms of data collection as well as then data that we would want to expose for stakeholders to consume that would be then useful and serve good purpose. I'll note that. Thanks. Chair,
right,
then
thank you.
may I just last quick one from my side. I'm so sorry, colleagues, but if I may please be excused just to pop onto another AI discussion. It's an AI IT day today.
No worries, no worries. Let's just see if there aren't any other questions for you, Christina. Anyone else with IT related questions? Okay, I don't see anything. I don't see anything. Okay, thanks, Christina.
Many
All right,
thanks.
great.
Thanks, guys.
Let's check on Kaiser again. Mukana, any feedback on Kaiser?
Please check my text, Dr. T.
Okay. All right, let's just check some Q&As. Any new questions? Let me see. We'll take a few more questions and then let's see. So I'm just scrolling on these. There's a few that came through. Okay, colleagues, please tackle some of these in the chat just to save us time. Medical devices, please address the question from Jabulo. My initial question has no response. Would devices for sexual wellness be classified as medical devices? If Dimagato Pusilato, you can speak to that. Then the next one is, sorry. Okay, your question, Zimasa, has been addressed. I'm going to skip that one. And then there's a question on, we received a query letter related to specification 2.1, although we submitted 3.1. This seems to be quite specific. So can I ask that you, because it says query letter, can I ask that you write to the specific unit, please, Shemaine? And then there's a question from Rahiman. It says, we submitted a baseline along with a variation in February. The variation tracker still reflects e-submission. How do we confirm that ECTD has been received under the evaluation? Again, I think there, if you could, there's been follow-ups with HPA. So Pratibha, will you and your team look at that and address it? I think it's another very specific one. And then just a comment for Kristalna. Could Kristalna have a look at the registration process for portal? The address search list does not cover all the addresses. So we'll look at that. Pratibha, take note of that question, please. Okay, so thank you for consolidating these questions for CAMS. I just need to check. Yeah, Kaiser will be with us just now. Okay, I don't see any other questions. All right, if Dimakato, do you want to comment on the question on classification?
Yes, I can. I was actually trying to respond. So in this meeting, Chair, we cannot comment on various products. Firstly, the person that have shared the comment must speak to the manufacturer that will know what classification is a product. We have published our guidelines regarding classification, and also I will advise them to look at the definition of a medical device. What is a medical device? And then they must look at the intended use. Based on that, then they will be able to, so they must ask the manufacturer to assist them to define whether their product is a medical device or not. Thank you.
Okay, thank you for that. All right, let's see. We'll take one more question. I just need to read it. Okay, so there's a question from Jacques. Has the schedules been updated? I think this one on the, it's a very specific one. So I know Totlang is dealing with it on the revised schedule. So can I ask that we deal with the applicant on this one? Okay. Yeah. Okay. All right. I think what we could do, if Kaiser hasn't joined, I mean, you know, there's a workshop we'll be having with industry. So these can then also still be tackled. I think it's scheduled for some time, unless it no, it's not Temba. Temba is in Paco's area. Yeah, we can tackle them then, if he hasn't joined. Oh, Kaiser, please. There's questions for you. I see you've joined.
Yes, Chair. Thank you very much, and apologies. Regarding the request for the CAM's possible approval time, in terms of process, we have been saying from the time that an application is received, it takes 15 working days for that application to be reviewed by an evaluator. Once the evaluator has submitted the report within that 15 working days, a SAHPRA query letter will be shared with the applicant, and they too are afforded 15 working days to respond. The challenge that we have been seeing, Chair, is that the delay should not be seen as a SAHPRA issue only. I've been saying this in numerous CAMS RTF working group meetings. Each time we send out a SAHPRA query letter, either the applicant will keep requesting extension of time, or we have to follow up on responses because they are also not meeting the 15 working days. Now, the other issue that needs to be taken into consideration insofar as the license application is concerned, we have six different types of license applications. We have DL01, DL02, DL03. Just to be clear, DL01 is manufacture, import, and export. DL02 is import and export only. DL03 is wholesale and distribute. Then we also have amendments, DA02 and DA01, as well as renewals. Now, if you receive a response on a DL01, at that time, we will be working on all the DL01 that we have on the system. Once we are done with the DL01, then we move on to the DL02s. And in that way, it ensures that each and every applicant within the system has a fair chance and equal opportunity to have their application reviewed. So the delay, if it's there, may also be emanating from industry themselves by not responding or continuously asking for extension of time. The other issue was about the signed 3D product list. Why are they not uploaded in time? Like we say, we have been following that process of saying we work per license type. But I also indicated in the last CAMS RTF working group to say the unit is also looking at prioritizing those that have already been recommended for granting. We call them the SAHPRA final, and an applicant have signed the 3D list. we're looking at mechanisms that would not allow these applications to follow the normal process and queues, so that they are also being attended to in time. I think I've addressed those queries, Chair.
Thanks. Let's maybe open it up. If anyone has follow-up questions for Kaiser, we can open up. You can raise your hands and we can take those.
And just maybe to be to put it up there, Chair, if an applicant has not received any feedback from us, you are welcome to email. And I always advise applicants to use the dedicated email address, because in my absence, when you write me, I can only see that email when I'm back. Thanks, Chair.
Thank you. But I mean, we would always have someone acting, right, who should be able to deal with these matters. If they can't, they must then let the applicant know that they'll revert on your return. Yeah.
But if the email is directed directly to my Kaiser@SAHPRA email, the acting cannot access that.
That's noted. Thank you. I don't see hands, Kaiser, so it looks like there aren't further questions. Let me just go to the Q&A. There's a question here, Kaiser. Can you just respond to on the chat, which email address for follow-ups should be used, please? Just put it in the chat. Thank you.
Okay.
That's from Wayne. So, okay, we seem to have addressed all the questions. If there's anything that you raised in the chat or in the Q&A that we missed, please raise your hand so we can take your question, and then we are working towards closing the meeting for today. We all covered. Okay. I don't see hands. All right. See. Thank you so much, everyone, for joining. My camera. Thank you, everyone, for joining this session. Again, let's please utilize, the working groups to address a lot of these issues, and, engage with the team on the unit-specific email addresses so that your query is attended to. But we do thank you for joining this meeting and for raising the questions that you've raised. I think it can only make our collaboration more effective, as we all have the same shared goal within the sector. So thank you so much. If I don't see some of you at one or other meeting, virtual meeting, etc., it is that time of the year where we can wish people a Merry Christmas. It's always an exciting time. It's a downhill from now. So wishing you all happy holidays, a good break. And as I said, we will communicate the SAHPRA closure period on our website. Okay. I see there's one, the hand went up and then down. Maybe it was an error. So thank you so much, everyone, for attending this session. We appreciate it. Oh, Yaku, do you have a question or is it a technical glitch? No? Okay. All right. Thank you. Thanks, everyone, for joining. Have a good day further.